You have probably heard a lot about face masks and COVID-19. Here at Muscatine County Public Health, we want to provide you with the facts about face masks to keep you and your community safe. COVID-19 is a virus that spreads through tiny droplets when we sneeze, cough, or talk. If these droplets enter another person's mouth or nose, the virus could get into their body and make them sick. People can also get the virus if they touch something with the virus on it and then touch their mouth, nose, or eyes. Some people with COVID-19 might feel sick, but others might feel just fine even though they have the virus. This virus can be very serious and even cause death. It is important that everybody wears a face mask when around others or out in public. Wearing a mask when you are near other people, like at the grocery store or the doctor's office, is a good way to stop the spread of COVID-19 and to keep yourself and others healthy. So what does a face mask do? A face mask is a covering that goes over the nose and mouth. You've probably seen a surgical mask used before, but they can also be made out of 100% cotton fabric. Doctors and scientists have been studying how effective masks are at stopping the spread of COVID-19. And it turns out, when worn correctly, masks are very effective at slowing the spread of COVID-19. Face masks help stop droplets from getting into the air or landing on a surface. And it makes it harder for the virus to get into another person's body and make them sick. If you have a surgical mask, you can wear it over your nose and mouth. However, if it gets wet, sweaty, or dirty, you will need to throw it away and get a new one. You cannot wash this mask. You can also use a cloth mask. If you sew, you can make them yourself or you can buy them. An effective cloth mask should have at least 2 layers of fabric and be made out of 100% cotton fabric. These masks can come in many sizes and styles. Some even have a pocket for a filter to be inserted. No matter the style, they should easily cover the mouth and nose. Cloth masks should be washed with soap and water regularly, when dirty or when wet. You can throw them in the washing machine or just wash them in the sink. If you can't get a mask, you can use something like a cotton scarf, towel, or t-shirt. Just fold the fabric over at least twice. Put rubber bands or hair ties on each side. And fold in towards the center. Then just hook the rubber bands or hair ties over your ears and your mask is done. Your mask should fit snugly against your face without gaping or sagging. Always wash your hands or sanitize after touching your mask or taking it off. Remember, the mask won't work if you leave it on your chin, only over your mouth with your nose exposed, or just hanging off your ear. It needs to be in place, covering the nose and the mouth. You may have heard that wearing a mask is not safe. This is not true for most people. Both surgical and cloth masks are safe and do not affect how much oxygen you get. There are, however, some people who should not wear a mask. This would include children under 2, people engaged in physical activity, if someone's doctor recommends against it, and anyone who would be unable to remove the mask on their own, such as someone who is unconscious. People who cannot wear a cloth or surgical mask might talk to their doctor about wearing a face shield instead. Be sure to keep your mask clean and replace it when needed.
For some people, wearing a mask might feel uncomfortable, especially during hot or humid weather. However, it is very important that when possible, people wear a face mask over their nose and mouth. It will help protect them and protect others from the spread of COVID-19.
We have linked some mask designs and information below. Here at Muscatine County Public Health, it is our duty to work to keep our community safe and to provide you with facts. If you have more questions, please give us a call at 563-263-0122.